fundamentals lab, and we're practicing enteral feeds today. So this is a patient with a nasogastric tube, and he's going to be receiving a feeding. So the students are going to be checking placement and then administering a feed. You see she's got it clamped. She's put the cap on the end of her feeding tube. We're still clamped. And now we're going to administer the flush. Tube. What do we want to tell the patient at this point?
Tell the patient?
Yeah, or ask or tell or...
Well, he's not going to feel full, right? Because it's
probably not, because this went in, what, 40 mLs an hour? What's how many ounces is that? Do you remember your conversion? Not one. Oh, did you say? You said 40 mLs? 40 mLs. How many ounces is that? What's the conversion factor? Everything that we just did now, you can do on that mannequin through his nasogastric tube.
I'm assuming gravity on that one, you would hold the tube all the way up.
You might have to hold it up a little bit higher.
Okay.
Usually not that high, as long as it's above, well, above what level. But you'll be coming it over because this is medication administration, right? Okay. So you're going to follow all the procedures for medication administration. Okay. Okay? All right, let's move over one to medication administration via a PEG tube. Okay, so we'll take one of those. We're going to follow all the medication administration guidelines, okay? But in the interest of time, yep, you would wash your hands, right? Yep, we've checked we've checked our physician's orders, we've done our 3 checks for medication. Does he need to wear gloves for this? Not for medication preparation, not necessarily. Okay. Air, pour out gastric content, check pH. Now, of those 3, the air is not the least effective, but when you're doing it first, just the whole layer here, and you're trying to get this in here. So, Silas, bring that right around to you. Go ahead and bring your supplies up close to you where you're working so that you have everything accessible.
Texting to say, one of my students, and she is going to be interviewing a character named Jamie, and Jamie is a paranoid schizophrenic who is actively listening to auditory and visual hallucinations. So here we go.
He learns cursive or whatever the hell he does.
That's fun. So you have a good communication with your son. He's not angry about that. Why is that when we're talking about...
Because you won't tell me where my son is.
You just said your son is in the UK.
Time is on my son.
Yes, it is.
So you're just going.
What? So let's talk about your son. He finger paints with you, and you play games with him.
Well, you know, I'd rather not really talk about it. I feel that if you want to get to know me, we should get to know you first.
Well, see, we're here for you, so how about you tell me a little bit about you?
Wow, you're so caring and beautiful and wow.
So what are you working on?
Oh, I don't know, I'm just doodling.
Taking some pictures?
Doodle, you know.
Is that your favorite color?
No, I mean, to be honest, I love all the colors.
All the colors?
I mean, because, well, I'm an artist, and I like painting things, drawing things, anything, and I don't know. I mean, color's really important to me. I feel like it just brings out the life and things, you know, like your eyes. Like, you know what? Hey, back up!
Easy now. I'll be ready.
How many? I need some juice.
Okay, give me some juice.
Juice?
Let me go ahead and finish. Can I just have you sit down? As soon as I'm finished doing his, I'll go ahead and make you do your juice, okay? All right? All right.
Get out!
Hey, calm down. Calm down. Calm down.
I'm so sorry about her.
With Renee Frankwith, and Renee's going to walk us through what's going on in this lab? This is nursing 208.
This is nursing 208, maternal child, and in this particular lab we're focusing on the postpartum mother and the baby after delivery.
Great.
So the students in this lab will be rotating through various stations so that they can get some hands-on experience with practicing some of the skills they'll need to do in the clinical setting. In this particular station, they're going to be performing what's called the Bubble HE, and this is a standardized assessment that nurses will perform after a delivery so that they can evaluate all systems of the mother after she has delivered, and it involves looking at any incisions that the mother has had, any functioning of the bowel and the bladder. It also takes a look at neurological status, and it looks at the uterus as well to make sure that all of those systems are functioning as we would expect after a normal delivery. In this particular station, one of our faculty members, Judy Grimm, who coordinates maternal child, she's working on some care post-operatively or post-delivery for a mother who's had say, an episiotomy, which requires an incision in order to do the delivery, so that there's good incisional care of that area, no infection occurs. They also learn on this type of mannequin how to do what we call fundal massage. The fundus is a muscle, and after delivery, it's possible for that muscle to bleed. And we teach students how to do the fundal massage so that there isn't any bleeding that occurs post-delivery, and that the mother doesn't hemorrhage or have any complication. In this station, the students are learning how to do what we call a heel stick. A heel stick is a venipuncture that's performed on infants after delivery, and the purpose is to assess the baby's glucose level. Newborn babies have can have very serious issues with their glucose level getting quite low, and so that's a procedure that's closely monitored in all newborns after delivery to make sure that their blood sugar doesn't drop too low. Students are being instructed on a normal newborn assessment. Again, after delivery, it's very important for nurses to make assessments to note whether or not there are any abnormalities that are present. Oftentimes these may be diagnosed in utero before the baby is born, but some defects may not be noticed until after delivery. And so students are taught to do a head-to-toe assessment of all body systems, heart, lung, neurological, abdominal, and some of the things we particularly pay attention to are the baby's muscle tone, the cry of the baby in terms of the sound of it, the pitch, the quality of the cry that really reflects their central nervous system. Obviously, color is very important as far as that baby is breathing normally and not having any difficulty.
These students are doing a respiratory assessment on a mannequin. There's a simulation that they have to read, and then they have to go through and decide, based on their assessment, what to do with this child. So that's what they're doing right now, is assessing, and then they have questions that they have to answer as far as teaching and things that have to do with the child with a respiratory issue. So this activity takes about 20 minutes for them to complete, and they can work as a group to decide what course of action they would take. Over here is an independent activity where the students are doing a number of things. They are assessing the child and assessing them for safety issues, things in the crib and that might be dangerous, and things that are going on with the child that they consider a safety issue. They're also doing a pain assessment scenario on a child where they have to base what they do treat for pain based on the child's behaviors, called the Black scale. And so they have to also medicate the child, so they have to look up the safe medication dose, and they have to decide how much to give to that child. And then also we have specimen supplies that they have to, specific to pediatrics, that they have to learn about. So they have to look at the different supplies, and an instructor will explain, Christina in this case is explaining to them what those specimen supplies
Are you done with this?
are for the child.
Office with Tina Zimmerman, and we're about to see her do a demonstration. Tina, can you explain to me what it is we're about to do?
Sure. I'm going to demonstrate to the students how to administer medication through a PICC line. That's a peripherally inserted central catheter. And they've not had this skill yet, so they will see me do it, ask questions, I'll explain it to them, and tomorrow they'll have the opportunity to practice it in the lab, and hopefully while we're in the hospital they can actually do it.
Cool.
On a patient.
Awesome. Thank you.
You're welcome. About PICC lines, all right? So can someone tell me what PICC stands for?
Peripheral insertion.
What kind of catheter? Central. Good. Peripherally inserted central catheter. Now, what would be some reasons that a patient would have a PICC line in as opposed to a regular peripheral
They
midlock?
couldn't keep them, they kept getting infiltrated, they have small veins, it's hard to find one. It's
Perfect. Or what about someone who needs to be on antibiotic therapy IV for 6 weeks? Have you ever heard of that before? Yeah. Like infections of the heart require a lot of IV antibiotics for a long period of time. So they will put a PICC line in sometimes because it is easier to keep that access than a peripheral line, okay? And scrub the hub for 15 seconds, right? All right, so 15 seconds, scrub the hub. Meanwhile, remember, you're explaining all this to the patient. Don't forget the patient here, okay, why you're giving this, you know, what you're doing and all that. Okay, I want to give 5 mLs of this saline, not all 10, all right? And you have an order to give, what is it, Dilaudid maybe? Okay, Dilaudid. All right, so we're going to give 2 milligrams IV push, Dilaudid, all right? So here is, I'll let somebody else do that. Here's Dilaudid. So if I want to give 2 milligrams, how many mLs am I going to give? 2. Very good. So would you shoot for me?
So through this mirror here is actually a window. And back here is a lab and all kind of technology where this guy here is controlled. This is one of the cooler labs, MedSurg 3. So we're here with Madeline Danner in MedSurg 3. And Madeline, what are we about to do here?
We are about to do a patient simulation. We have SimFan here, who is made up to be a patient. We have a patient chart, and our students in the semester are going to get a patient scenario where the patient is going to have a problem. They're going to have to assess the patient, manage the patient, and call the physician, take orders, and implement those orders, just like they're going to have to do in real life in a couple of months. He's a 72-year-old who was admitted with COPD. He's been smoking for the last 50 years, long history. For me on night shift, he's been alert and oriented, been a very nice man, really like him. He's got pneumonia, but it looks like his white cell counts are improving, and he may possibly even go home today or tomorrow. I've had no issues with him. He's doing good. I think he probably will get to go home today. All right? Any questions?
What's his pulse ox?
94%. He's on 2 liters. He doesn't wear oxygen at home, but he's been wearing oxygen most of the time he's here because he's still...
Just nasal cannula.
Yeah,
No,
just
it's not
nasal
on right
cannula.
now.
Well, you know how those patients are. Sometimes they take them off.
Okay.
We'll put it on. Oh, Mr. G, you got to keep this oxygen on.
Okay, I'm going to take your blood pressure, all right?
Hi.
I didn't think it was that bad. Left-sided chest pain, but I thought I heard you say something about on the right, and I was making sure.
No. I turned that off. I said it's going to be right in a minute.
Okay.
No.
Did they listen?
It really hurts.
And I turned his lung sounds off if they do listen.
Okay.
It really hurts. Oh.
Dr. Nunez.
What?
I just can't breathe.
What's the matter?
It just really hurts.
And now I'm going to put some numbing medicine here. This is going to sting. You're going to feel this. Okay.
We've learned so much.